Hi, how are you? Hope you all are doing well. Welcome to my channel Nursing Made Easy with Sharanya Sajid. So, I came with another video. Today, I'm going to discuss with the part 2 or the continuation of the previous stations of aptitude test in Ireland. I have discussed 5 stations in my previous video. The sixth one is here. Scenario of 22-year-old man with head injury. So you may get a station with the patient who has head injury. So what you have to learn in this station is you should know about of neurological assessment using the Glasgow Coma Scale. I hope you all know Glasgow Coma Scale. If you don't know, you can give the comment. I will put another video for that. Next station is scenario of 55-year-old woman post abdominal surgery communicating the patient's deteriorating condition. So here you are getting a patient who is just after the abdominal surgery, and you have to communicate with the patient about her deterioration. He is deteriorating or she is deteriorating. You have to communicate. So here what you have to learn is bar communication and assertiveness. So you may wonder what is bar communication. It's nothing but it's a way of communication with the patient and nurse. Here I'll show you is bar. That is a short form of ISBAR. I means identify, S situation, B background, A assessment, R recommendation. This is the way we should communicate. That means if you're talking with the patient, first you should identify, is that Sharanya? Okay, I'm going to explain about your abdominal surgery. I know you just after your surgery, but when we have assessed, it has been noticed that there is some infection in the surgical site. Maybe you will get the situation. I'm just telling, I'm just making stories. So you will get the proper situation in the station. So likewise, with the using this ISBAR tool, you should communicate with the patient and you should be more assertive. Assertive in the sense you should know about your rights and the patient rights, and you should communicate well. So here they are going to check your communication skill. Then next is a station scenario of 55-year-old woman with history of epilepsy. So what is epilepsy? Seizure. So of course, by seeing this station, you can understand they are going to assess your management of seizure. Of course, you should know about patient safety when the seizure episode is occurring. We should know the environmental safety. We should make sure there should not be further injury due to the seizure. All the nursing management of seizure have to learn so that you should easily pass this particular station. There they are going to check your management of patient who has seizure. Next is a scenario of 55-year-old woman awaiting back surgery. That means a patient who is waiting for the surgery. Here your task will be like you have to communicate with the patient, and you should be like give psychological support. Like if a patient who has the surgery, of course they will be nil per oral. Maybe they will ask like, I'm hungry, can I eat something? So you can communicate with them and what is the consequences, and you should give psychological care because patient may be more concerned and they may have lots of fear. Those things will be expressed by the patient. So if you done OET speaking, maybe it will be easy, that station. The next station is a scenario of elderly woman receiving end of life care, DNAR in place. So there is a spelling mistake, I didn't write N in place. DNAR is means it is a do not resuscitation status. That means if that particular patient is at the end of their life, and if we do the CPR for that patient, there won't be any good outcome. Because of that, that medical team itself discussed the outcome and they have placed the status for the patient like DNAR, do not resuscitation. In case of any emergency, we don't want to resuscitate this patient. That's what it means. And here your task is you have to communicate with the next of kin. Next of kin in the sense relative about the deteriorating condition. It's the end of life. So the patient is going to die. So you should be empathetic and you should communicate with using is bar as well. First of all, you should identify, then you should uh, explain the situation, background, assessment, and recommendation. That's is bar. So you should be very careful when you are communicating. You should remember about is bar. Then next is a technical skill of 65-year-old woman with chronic renal failure, unresponsive and not breathing normally. So if a patient is unresponsive and the breathing is not normal, what we are going to do? Of course, we will do the CPR. So this is a station for CPR and emergency care. So you should read everything about emergency care and CPR. Sometimes you may get this kind of station. So if you are getting that station, you should start the CPR or what is the emergency care you can give. So you should read about the emergency care. Next station is a technical skill of medication management. So, in the medication management, it means you may get a patient. So, they will tell you to administer oral medication. That means you will get the tablet as well. So, you have to give that to the patient. You won't get the real patient. Maybe the examiner itself pretend as a patient. So, you have to give medication in the hands and you should give education, and you should know about the 10 rights of medication management. All the management of medication you should read, then you can do this station easily. In the patient education, you can say just look for any allergies if you feel dizziness, or you may have pain or something like that. You can give the education. For example, patient who is taking the digoxin, if they get the low pulse, weakness and all, we will tell, no, the same kind of education we can give. Next is the technical skill of abdominal wound dressing. So this is very important station. I have seen many of the students are losing this station. The main reason is here just you have to do the dressing, but time management. Time management is very important, and all the aseptic technique and universal precaution. That means the trolley, how you are maintaining the trolley, how you are discarding the waste, and how you are doing all the procedure in the aseptic way. So you should be careful about that. So thank you for watching. That's all for today. I'll be continue with my future video with the stations. I think 4 or 5 questions are more. Then I will do each and every station in detail. Thank you.